Every moment matters. Every decision shapes recovery. All Things Neuro and Neuro 360 is a specialized neurocare organization focused on the diagnosis, treatment, and rehabilitation of traumatic brain injuries and concussions. A multidisciplinary team works together to deliver coordinated care, guided by advanced diagnostics. All Things Neuro and Neuro 360.
We are excited to be able to partner with medical providers and also attorneys to offer different elements of neurotrauma to the market. It's one of those areas that is really underserved with education. I know a lot of chiropractors have some basic understanding, but what we have been finding in the market is that there are a lot of new things that have come forward, new studies, new technologies, new modalities. And being able to be that resource for you is important to us here at All Things Neuro. So before we get started, introduce Dr. Joe. I just want to give you a little background about All Things Neuro and who we are, why we do what we do, and how we can be a resource to your clinic. So All Things Neuro. We are an umbrella company that can offer a comprehensive solution for anything related to neurotrauma. We have board certified clinicians at every level, every angle, whether that's a neurologist, a psychologist, neuropsychologist, speech language therapist, functional neurologist, physical therapist, psychiatrist, the whole gamut. There are so many different elements that need to play into resolving TBIs and concussions, PTSD, that we have all the players under this. And what we found is that so many have been overlooked. Those who've been injured have been dismissed, disregarded, overlooked, and it's done a disservice for those who've been wrongly hurt. And so our mission is to be able to offer continuity care from right after they've been injured, to be able to get an evaluation with a board certified neurologist, MD, help get the testing they need to get the results, to understand what happened when they were in this injury. Then going over the results, recommending a treatment plan that is customized for them. So that's why we have so many players with this. Every injury is unique in itself, and every recovery is going to look a little different, their pathway. And so we want to be that solution where we can have a slew of services and experts at the table working together hand in hand. And not only do we help with the brain injury of a concussion and TBI, the little sister of that is PTSD. And we're going to talk a little bit about that and how these all work hand in hand. But PTSD, we offer psychological evaluations, neuropsych. We have different modalities to help with counseling, therapies, cognitive rehab, all the areas to help get that full recovery. And so we're looking for people who are both on the medical and legal side to partner up so that we can all work together to help bring recovery all around. That's why we need chiropractors. They are a big component to that recovery solution. So just recapping the testing, the rehabilitation, and then the telehealth side with the mental health side, those are all important elements of being able to recover with that. So we want to partner with you. This is my contact information. If we get back to it at the end, I want you to have this. Please, this is my cell phone. Reach out to me or whoever invited you to this. And I'm going to be done with that so that we can really get into the meat of why we are here today. We have Dr. Joe here. You know, I can do your little bio, but you spit it out pretty well, but I would love to brag on you. But I think it's really important that people understand that I hate it when people, especially attorneys, but overall say, oh, they're just a chiropractor, because that is just really demeaning, especially for people who have gone the extra mile to get certain certifications and enhance their practice overall. So let's just start out by you explaining all the different areas that you are an expert in, credentialed, and then we can kick it off.
Okay. Well, I've been in practice 41 years. The same practice in Marietta, Georgia. We have offices in Marietta, Duluth, and Stockbridge. I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition, traumatic brain injury, BS in nutrition, a syndicated columnist, newspaper columnist. Yes, there's still some newspapers out there. I host what I believe is one of the largest, if not the largest radio show in the world, based in Atlanta on WSB Radio, on health and wellness. I've been on Dr. Oz's show. He's been on my show. So we've got a pretty good background on this. And our approach is not just treating the injury, it's treating the patient. And I hope all doctors get that when I say that. Somebody's in a car accident, you want to treat the car accident injuries. Of course you do, but what about the patient? What happens if they have PTSD? What happens if they had a traumatic brain injury? We can diagnose the heck out of these things, but what do you do for the patient? And that's how I want to continue on with healthcare. I think that's where healthcare needs to go. Stop treating the patient as a diagnostic code. What does the patient have? What can we do to get them well? And the next hour or so, less than an hour, I guess, we're going to give you so much information on how to treat that traumatic brain injury, not just diagnose it, but how to treat the patient. So we'll go from there. We have to make sure the gut can brain. That's my background. Okay, skip over that. Next slide. There you go. Okay. Oh, okay, back one a little bit. So the brain has to have the nutrients to heal, and 15 to 30% develop persistent symptoms. I believe that number's higher. Now, that's what the research shows, but in my personal experience, people have injuries, they have a lot going on. Brain fog, anxiety, digestive problems, fatigue. So the standard of care that usually is done is symptom-based. Somebody has brain fog, well, maybe, and I had somebody tell me this one time when I had a traumatic brain injury. I was hit by a car when I was 10 years old, severe traumatic brain injury. I was in a coma. They thought I was dead. And so I remember early on in my career, going to a neurological expert, and they had an expert who worked there on nothing but headaches. And the lady said to me, and the nurse said to me, she said, people like you are going to have headaches. People like you are going to have brain fog. And you just have to accept the fact that you're not going to ever be a CEO, that you're not going to be able to run a company, that there are going to be days of the week that you're going to have to be immobilized due to the pain. And that was her answer. Headache expert telling me there's nothing that can be done for me. And I thought, I didn't accept that. So that was, she said you could take over-the-counter medication, we give you prescriptions. I don't want to treat my symptoms. I want to get to the cause. So let's talk about this gut-brain axis dysfunction. So in a post-concussion syndrome, oftentimes treated neurologically, but autonomic and gastrointestinal dysfunction and central components are prolonging the recovery. So what happens is my brain is damaged, there's inflammation. Every brain injury, every brain issue, every emotional issue, there's going to be an inflammatory component. So we have to address one thing universally is how do we bring down inflammation, not just in the brain, but in the entire body. So if somebody has a bad diet, you're eating the typical American diet, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, you're eating the standard American diet. All of those foods are going to cause an inflammatory reaction in the gut. Now, if you remember way back when you went to school, there was a connection between the gut and the brain by way of the vagus nerves. And the vagus nerves send messages from the brain to the gut and back up to the brain again. So it's bidirectional. So if the vagus nerve is damaged, it can affect the immune system. It can affect endocrine signaling. And it can affect the microbiome. 45 years ago, when I first got into biochemistry and nutrition, we talked about the gut. We talked about the bacteria in the colon. I don't even know if the word microbiome was even being used. And it was laughed at. I remember talking about leaky gut one time, and it was a medical doctor in the audience, and he said, there's no such thing as leaky gut. Your gut is sealed, and you don't know what you're talking about. And I went, wow, am I wrong? Well, I wasn't wrong. He was wrong. And so the gut has cells in there, and the cells have to be tight together. They have to be tight junctions. Things can happen where the junctions open up. There's little gaps that are created. And now with this gap, food, bacteria, fecal matter can get into the blood system. Now, if I have a foreign object in my blood system, the immune system says, I don't know what this foreign object is. I'm going to attack it and cause an inflammatory reaction. That inflammatory reaction becomes systemic. So if I have an inflamed gut because I have a bad diet, I have leaky gut, I don't have good microbiome, I don't have the right nutrients, that inflammation is going to affect my brain. So we can document the heck out of a case and say, okay, Joe is in an accident, he's going to have brain fog, he's going to have permanent damage from this, and let's get a good settlement. Joe, the patient, is going to say, you know what, I'd rather get better. How do I get better from this? Now we have the best of both worlds. We can get a good documentation and present it in the case, but we have to be able to treat the patient. So 80 to 90% of vagal nerves are afferent. They go from the gut to the brain. That's a lot. So the gut is talking to the brain more than the brain is talking to the gut. So if you have digestive issues, you have a problem. So, there you go. There you go. All right. Oh, stay there. Stop. Gut signals heavily influence mood, cognition, inflammation, autonomic tone. So the autonomic nervous system, if you remember back in school, works automatically. Remember autonomic, automatic? And so if the autonomic nervous system is being affected, we have a problem. So let's go back to vagus nerve function. The vagus nerve is a parasympathetic nerve. Parasympathetic nerves slow you down. Sympathetic nerves speed you up. So the vagus nerve controls the enteric nervous system. There's a word you hadn't heard in a couple of decades, right? The enteric nervous system is your digestive system. So we have the peripheral nervous system outside the spine, the central nervous system, spine, brain and spinal cord, and then we have the enteric nervous system. And I remember in class, we went over it real quick, probably, I don't know, maybe 10 or 15 minutes, moved on. Well, the enteric nervous system is the reason we're alive. You can live without an arm. You can't live without a digestive system. And so the digestive system, think how amazing your digestive system is. You can eat a double beef cheese burger, perhaps having meat in it, and God knows what's in these fast food burgers, on white bread with ketchup, which is 42% high fructose corn syrup or sugar. And somehow, some way, this enteric nervous system breaks it down, reassembles it, and creates things like serotonin, dopamine, norepinephrine, neurotransmitters, toenails, hair, skin, eyeballs. So the enteric nervous system is so complex. It's crazy. So if you have a digestive problem, we're going to go into this in a second, but I want to make sure we get the basis down. Your stomach has one main job. That job is to digest protein. Now, protein can come from a carrot, can come from a steak. Protein is pretty much everywhere except water. Now, if we look at protein under a microscope, it looks like a ball of yarn. So your digestive system unravels the ball of yarn and chops it up into something called amino acids. There's 20 amino acids in the human diet, 9 of which are essential. You have to get them from an outside source. The other ones your body can make. So your stomach takes this protein, whether it's, let's say it's from a carrot or a steak, unravels it, chops up the amino acid. The amino acid tryptophan goes into your small intestine and combines with something called vitamin B6. Now, you can take vitamin B6 as a supplement, but it's also called a postbiotic. If you have healthy bacteria in your colon, it's going to produce things like B vitamins. B6 and tryptophan create something called 5-HTP. 5-HTP converts into serotonin. Now, serotonin, about 90-95% of it is made in your gut. When I went to school, I was taught it travels from your gut to your brain. Well, research since then has proven that wrong. Your brain produces its own serotonin. Serotonin does what? It calms you down, helps you focus. Serotonin converts into melatonin, which helps you sleep. So if you don't have good digestion, heartburn, acid reflux, burping, gas, bloating, diarrhea, constipation, you can't break down the protein into amino acids. You can't get the tryptophan to combine with B6 to create serotonin. So now we have a problem. Because if I have an inflammatory issue because my brain is sending messages along my vagus nerve to my gut that something's not right, it can affect my production of neurotransmitters. Tyrosine becomes dopamine, 50-50, dopamine produced in the gut and in the brain. And so you have to have two separate productions. So tyrosine becomes dopamine. Dopamine converts into norepinephrine. Norepinephrine gives you what? Energy. So if I have dysbiosis, bad bacteria, if I have gut dysregulation and I'm not breaking proteins into amino acids, I can't produce the neurotransmitters. So now a person can have all sorts of problems. Focus, energy, not having pleasure in life anymore. And we can document this in our case, but what do we do about it? Let's go to the next slide. So the vagus nerve dysfunction after a trauma. My brain gets smacked around. I've got a concussion, cervical trauma, autonomic disruption. So symptoms, reduced vagal turns, sympathetic dominance. We're not going into our parasympathetic function. Parasympathetic is sex, sleep, digestion, just having a happy conversation. So I'm in a sympathetic dominance. I'm wired all the time. I can't relax. I can't focus. I can't enjoy life anymore. That can affect digestive motility. Okay, my food isn't passing through my colon like it's supposed to. You might have constipation after a traumatic brain injury. And so the food is sitting in my gut, basically rotting. And that's not a good situation. And that'll increase inflammatory cytokines. So what are some clinical symptoms you might see with a patient who has a brain injury And it's vagal disruption. You might see constipation. You might see bloating. You might see anxiety. Heart rate variability reduction. The heart is not speeding up when it's supposed to and slowing down when it's supposed to. I find this, and I found this way back in my career because I had this condition, that if the vagus nerve isn't working properly, it can affect digestion. And the vagus nerve also has some control over the heart. So I found that if my gut wasn't working right, if my stomach was pushed up into my diaphragm, for example, in a hiatal hernia, I had rapid heart rate. But one of the earliest memories I have as a child is laying in bed and my heart racing and then stopping. And then racing again, and then irregularly beating. And I remember thinking, well, I'm a kid. I guess everybody, this is how your heart beats. That was my AFib. Now, many times in medicine, if you've been in practice long enough, you've had patients that have AFib, and we send them off and they get ablations. We'll shock the heart, we'll burn the heart, and try to get it to beat properly again. Never in my career has any patient ever come to me and said, I have AFib, and the doctor wanted me to check my digestive system to see if we can get the brain-gut axis working properly again, to see if we can fix my AFib. And in many cases, the stomach pushes into the diaphragm. We can physically pull the stomach down away from the diaphragm. It's an adjustment. When we do that, many times it stabilizes the AFib and takes the stress off the vagus nerve and the enteric nervous system. So you may have a brain issue, which causes a neurological issue, which causes a physical issue. So we have to go all the way back and fix the physical to go back upstream again and make things work. All right, next slide. Okay, so cervical and brainstem integration. Brainstem houses the vagal nuclei. Cervical mechanoreceptors influence autonomic nervous system. Whiplash impacts the sympathetic tone, parasympathetic tone. So we have the whiplash. If we have the contra coup, the trauma to the brain, we're also going to affect the cervical spine too. So this is why when we adjust as chiropractors, we have to be very careful adjusting somebody with a traumatic brain injury and or whiplash, because if we go in there and we start racking and cracking on their neck, we could actually make the problem worse. We need to use gentle cervical stabilization. If you remember way back when, if you took an SOT class, cervical stair stepping, just taking a figure eight, rocking the chin back and forth into a figure eight, just to open up and loosen up the joints, take the stress off the facets. So the treatment, again, diagnosis is one thing. This seminar is about treatment, gently rocking things back and forth. You want to avoid those aggressive rotational adjustments if we're going to see the good recovery. I know sometimes we like to adjust the neck, we like to get noise out of it, but things like activators, stair stepping, just gentle trigger point work. Desjardins' work in SOT, the trigger points that he would use, the occipital trigger points and the trapezius points, just to get the body to calm down. Because so often that body is so inflamed, we can't go in there and do those aggressive adjustments. The patient gets worse. Patient gets worse. Hey, I went to the chiropractor and it didn't help. In fact, it made it worse. Let me go to the medical professional. Well, we can give you some injections. We do a median branch block, but those grow back sometimes. And they don't treat the cause, they treat the symptoms. Now, the cause could be the nerve, but we got to get to unpinch that nerve. So please understand, when you're dealing with a PI case, it's not like dealing with a young kid where you can go in there, maybe be a little more aggressive. You want to go really gentle. And I'm seeing the trend over the years that I've been in practice, the 40 plus years, that we were taught, the Gonstead adjustments, the rough adjustments, and I'm seeing more and more doctors coming out and going much more gentle. And I like that approach a lot better, especially as we get older. As I get older, I don't respond to those side posture, ripping, tearing adjustments anymore. I've got to go gentle. When it comes to a traumatic brain injury, we have to calm down so we can get autonomic regulation back again. So be careful with that. All right, next slide. Okay, dysbiosis after a concussion. So this is interesting. If we look at the reference there in 2018, the TBI alters the gut microbiome. So reduced lactobacillus and bifidobacterium, increased inflammatory species of bacteria, increased intestinal permeability. We talked about the leaky gut syndrome before, and elevated systemic inflammatory reactions. one of my doctors, I'm sorry, she came to me the other day and she said, hey, did you see this new study? And I said, no. And it turns out that people with low back pain have altered microbiome. So we're seeing such a connection between now the traumatic brain injuries, the cervical injuries, and now even the low back injuries, how it affects the microbiome. And the microbiome is everything. It's where you break down food, you absorb nutrients, you pass out waste products. It's your immune system. 70, 80% of your immune system is in the gut. It's the leaky gut. I don't know if I have a slide on this, but there's something called short chain fatty acids. I don't know if you remember that from way back when. Short chain fatty acids like butyrate help tighten up the junctions in the gut to prevent leaky gut syndrome. Because with leaky gut syndrome, you have, as we said, junk getting into the blood system, which causes an inflammatory reaction. Fecal matter, bacteria, undigested food, and that causes a systemic inflammatory reaction. So the dysbiosis after a concussion changes the gut microbiome. You may not be producing the good stuff anymore, but many times you're increasing the bad ones. And that's a problem. So we need to build up our short-chain fatty acids like butyrate. Well, we can't take a butyrate supplement. It doesn't work. We have to eat fiber. When you eat fiber, fiber feeds the good bacteria, which create, like Akkermansia, that break down, utilize the fiber, create the short-chain fatty acids. And short-chain fatty acids not only heal the gut, they activate something called the L cells. Now, the L cells are in the distal part of your small intestine, and they produce something called GLP-1s. You've probably heard of GLP-1s, right? They're all over the news. Everybody's taking them to lose weight. 1 in 6 people have taken or are taking GLP-1s. Isn't that crazy? And GLP-1s affect different receptors. They affect the stomach, so they slow down. They call it gastroparesis. They slow down the digestive system. And they also can go up into the brain, the hypothalamus, where your hunger centers are, and say, hey, I'm full. I don't have to eat anymore. And the GLP-1s affect different areas. And they have a GLP-5 in research right now. It's a whole nother story, though. But the GLP-1s make you lose your appetite. A lot of it has to do, the reason people are eating too much is because of gut dysbiosis, because they're not producing enough short-chain fatty acids like butyrate to activate the L cells to produce their own GLP-1s. So you may find with people after traumatic brain injury, they eat a lot. Now, it could be that they're depressed. It could be that they're home. They're not able to go out and do their things. But it could be actually a physiological reason why people are gaining weight after their car accident, because of the lowering of the GLP-1 production from the L cells. Isn't that cool? So when we start to fix the gut, I love it. I've been in practice 41 years. The number one reason we see patients is pain. The number two reason we see patients, digestive problems. So when you have some tools in your toolkit to say, you got a digestive problem, I don't know what to do about it, or take some probiotics, which actually can make the problem worse sometimes, what can we do? We want to see if the stomach is pushed up against the diaphragm. We can pull it back down. We want to see if the ileocecal valve is spasmed. We can massage it to get it come back in place. We see if there is a traumatic brain injury and it's inflammatory reaction in the upper cervical area, how to get those bones back in place to take the pressure off the vagus nerve. So then we can fix the gut, which can help fix the systemic inflammatory reaction, which then helps the brain work better again. I feel, in my opinion, you can't treat traumatic brain injuries without knowing how to treat the gut. You're just not going to get the results you want. I've tried it. Doesn't work. All right, next slide. Going off on tangents here. All right. So serotonin, we said 95% made in the gut. Dopamine, 50% made in the gut. GABA. What does GABA do? GABA suppresses pain, right? And brain-derived neurotrophic factors, some of it's made in the gut, but we don't have an exact percentage. I couldn't find it anywhere in the research. So disruption contributes to depression. Because we have an inflammatory reaction, get dysbiosis, we're not producing the neurotransmitters like we're supposed to, serotonin, dopamine. So even though they're produced separately, we have to have the raw materials produced in the gut. You have to have the tryptophan to create serotonin either in the gut or the brain. And if you don't have the proper breakdown of proteins, you can't get that. So we got to think about the gut more. The brain-derived neurotrophic factor, of course, protects the brain, which is wonderful. Now, dopamine becomes norepinephrine. Norepinephrine is going to give us energy. serotonin becomes dopamine. Serotonin, breaks down as well and helps you sleep. So this is why many times after car accidents, people can't sleep. So we have to be able to fix the gut so the patient can sleep so the brain can heal too. Making sense? Good. Hope you think of some questions for me. Let's go on to the next slide. So let's talk about the hormone disruption post-traumatic brain injury. So the HPA axis, dysregulation, hypothalamus, pituitary, adrenal. So that I'm not going to give you a whole lecture on hormones, but those guys all feed off each other. Hypothalamus, pituitary, and the adrenals all feed off each other, and there's feedback loops. So if we affect that, that's going to affect our hormones. What do adrenal glands do? Produce energy, produce hormones, and control inflammation. And so if the adrenals aren't working, it's going to affect a lot of different things. And as we get older, so I'm talking about older patients now with TBIs, their sex organs, the ovaries, the testicles, they produce a lot of the sex hormones. Well, as those organs start to, go through their life cycle, what's your backup plan? The adrenals. So what do we do to beat up our adrenals every day? Mental stress, physical stress, chemical stress, coffee, toxic chemicals, steroids, hormones, antibiotics, pesticides. If we're eating the typical American diet, a lot of the food you eat has been sprayed with glyphosate. Glyphosate, when it gets into the colon, acts like an antibiotic sort of. It kills off the good bacteria, which disrupts the microbiome again. So you've got somebody with a traumatic brain injury. It's affecting the microbiome. And then you're eating wheat. Most of wheat in America is sprayed with glyphosate. Corn, most of the corn in the United States is sprayed with glyphosate. They're out there in their lawn spraying weed killer. Maybe they play golf. How would golf have anything to do with it? A lot of chemicals on those golf courses. I saw a study that if you live within a half a mile of a golf course, you could be affected by the chemicals they spray on the golf course. So you got somebody, they have a brain injury, they're trying to get out, they want to rehab themselves, they start playing golf. They're getting these glyphosates and other chemicals in their body, which is affecting the microbiome, and that's going to affect the brain. Low testosterone. Remember, the testicles and the ovaries produce the hormones, and then the adrenals are the backup plan. Thyroid dysfunction, fatigue, weight gain, hair loss. I see this a lot with TBIs. Patients come in and say, Doc, I can't lose weight. Well, we talked about the L cells. Now we're talking about thyroid dysfunction. I can't lose the weight since the car accident. What are you eating? I'm eating less. I'm hardly eating anything, Doc. I don't have a lot of appetite because I'm in pain so much, but I can't lose the weight. Well, now we're looking at the hormonal disruption. Cortisol rhythm. If you never studied cortisol, and you probably did at some point, if you do a cortisol test, cortisol spikes in the morning and then drops off on a very simple slant as the day goes on. And so you get tired at night, you go to sleep. You go to sleep, cortisol starts to raise in the morning, it wakes you up. That's a normal cycle. So we can do a couple of things. We can look at cortisol, and if it's high all the time, that person's stressed out, chemical, physical, or emotional stress. If it's low, now we have adrenal dysfunction. And so what do? There are certain herbs you can give the adrenal glands to help, rhodiola, ashwagandha. These things can help rebuild the adrenal glands again. But you really want to talk to that person and say, listen, your cortisol level is just through the floor. We got to take the stress off it. I want you to give up your coffee. I want you to find out what's stressing you. And again, if the gut isn't working, you're not producing neurotransmitters, that's a stress in itself. And then melatonin disruption, because serotonin becomes melatonin, and so the person isn't sleeping. Now, during COVID, there was research that I read, and it turns out that melatonin not only helps you sleep, but melatonin protects the mitochondria of the cell. The mitochondria, if you remember in the cell, generates electricity. In the brain, one cell can have up to 2 million mitochondria. Talked about that in the last seminar I taught. So if we don't have good protection of the mitochondria, because we have proper melatonin, because we have proper serotonin, because you have inflammation, now the mitochondria can't work and the brain cells can't work either, and there's your brain fog. I know I'm throwing a lot together, but these all come together. These all fit together. All right, so I find a lot of folks have hiatal hernias. Now that can happen because the seatbelt pushes up and jams the stomach into the diaphragm. And it's a simple test. I use muscle testing to test it. And we physically pull the stomach away from the diaphragm. Now, I won't be able to demonstrate that on this seminar, but if you ever run into me somewhere, I'll show you how to do it. it is such a popular treatment. Because when you fix somebody's gut, they want to name their kids after you. Doc, I've had gas and bloating and horrible breath my whole life, diarrhea, I can't leave the house. Had a patient come in the other day and severe emotional issues, and 19 years old. And he has irritable bowel syndrome, a good general term. So they gave him antibiotics, which of course made the problem worse because it killed off a lot of the good bacteria. And so the treatment suggestion, let's remove his colon. He's 19 years old. Let's remove his colon. It's all inflamed. Let's remove it. What? My finger's swollen. Let's cut it off. I got a headache. Let's remove my head. I didn't understand the logic behind it. I did understand it. I joke when they say that. But their treatment is, we couldn't do anything about it, so let's just remove it. So just before I came to do this seminar with you guys, I was talking to his mother. And his mother said, it's unbelievable. 3 treatments so far. He's sleeping through the night. His pain is greatly reduced, and his bowels are returning to normal function. We pulled the stomach away from the diaphragm. We got him on some good probiotics. We adjusted, of course, the nerve supply to the colon. And one of the things we did that I can't document, I don't know how to document this one, is we gave him hope. Because up to this point, every doctor has said the same thing. There's nothing we can do for you. Game's over. Let's remove your colon. 19 years old. He was an athlete, couldn't play sports anymore. So when you have answers for the patient, there's a psychological benefit that occurs as well. Patients like getting well. And as I go off on a tangent here, right before I came to do the seminar here, I was talking to my staff, and my staff member said, now you're talking about traumatic brain injuries and how it affects the gut and how it affects the microbiome and the neurotransmitters. What about people that don't have traumatic brain injuries, that have emotional issues, PTSD? I said, the same thing applies. She said, that's really interesting, because I'd never heard that before. So what I'm teaching you isn't just for TBIs, it's for everybody. So if we have a hiatal hernia, we need to fix it. A couple of things you can do is, if somebody has acid reflux, many times they'll give them medication to lower the stomach acid. But what's the problem with that? You need stomach acid to break down proteins into amino acids to produce neurotransmitters. So if I reduce somebody's stomach acid, I effectively prevent them from properly absorbing calcium, B12, iron, and magnesium. So now they have a nutritional deficiency. So if somebody's in a TBI, has a TBI, and they're on antacid medications or proton pump inhibitors, we're not absorbing calcium, B12, iron, and magnesium properly. Pretty wild. See how it all ties together? So we may have to pull the stomach away from the diaphragm. Now, a little trick you can give them is you want to increase the stomach acid, not decrease it. So you can give them apple cider vinegar. Raw organic apple cider vinegar. Mix it with water, put it on a salad, put it in soup, swallow it whole. If you swallow it whole, rinse your mouth out so you don't eat away at your enamel. And that will increase your stomach acid to help break the proteins down into amino acids to produce the neurotransmitters, and you have better results. How cool is that? You tell the patient, I want you to do 2 tablespoons of raw organic apple cider vinegar every day as we're treating you. And we start to fix the gut dysbiosis, because now we're breaking food down properly, and we're able to produce the neurotransmitters and bring down the inflammation and able to take the stress physically off the vagus nerve. We see some amazing results. Because intrinsic factor, going to take you back to school again, intrinsic factor helps you absorb B12. Well, acid necessary to activate the intrinsic factor. If you don't have enough acid, you have a problem. So we need to up the stomach acid, not decrease it. It's counterintuitive, but that's how we get the gut working properly. All right, next slide. Boy, I'm running out of time here. All right, next slide for me, Jen. All right, neuroinflammation, systemic inflammation. The cytokine elevation, of course, remember pro-inflammatory cytokines, and we don't have a lot of time to go into that. Gut permeability increases endotoxins. Exotoxins means it comes from the outside source. Endotoxins are toxins produced inside your body. Fecal matter, bacteria getting absorbed into the gut. And then the inflammation prolongs the symptoms. So diet significantly reduces the inflammatory burden. So what do you eat? You want to eat more fruits, vegetables, nuts, and seeds, more plant-based. It's going to be much more anti-inflammatory. Number 1 food that causes inflammation and allergies is dairy. The number 2 food is wheat. So you want to take them off the dairy and the wheat. You want to get them on fruits and vegetables. Turmeric is a wonderful anti-inflammatory. So get them on a turmeric supplement. And now we take it from a nutritional approach to bring down that inflammatory reaction. All right, next slide, Jen. There we are. Okay. So let's talk about the functional nutritional symptom. I know I'm running a little late because we started late. Okay. You want to remove refined sugar, ultra-processed foods, and industrial seed oils. What's a seed oil? Anything, really, the only oils you should have in your life are extra virgin organic olive oil, extra virgin organic coconut oil, and maybe some avocado oil. Now you can do walnut oil or something like that, but that's it. Corn, soy, canola, safflower, sunflower, all of these are very inflammatory. Now, if it's an organic one of those, it's probably okay. If it's not organic, chances are it's been ultra heated, it had chemicals added to it, and it goes rancid. It changes the molecular structure. So extra virgin organic olive oil, fun fact, how do you know it's real? 70, 80% of olive oil has been cut with soybean oil. So what do? Take your olive oil, extra virgin organic, put it in the refrigerator overnight. If it gets cloudy, it's a good oil. If it doesn't get cloudy, bring it back to the store. It's been cut with probably soybean oil. I went to the big box store, I won't say which one, and they had two organic ones, one from Italy and one from multiple countries. I bought both. The multiple country one was junk. It never got thick. It didn't have that bite. I call it the two cough reaction. When you eat olive oil, it kind of bites the back of your throat and you go, that's a good olive oil. If it doesn't do that, it's not a good olive oil. So extra virgin organic coconut. Now, extra virgin organic coconut is a saturated fat. So if somebody has cholesterol issues, use it sparingly. So you want to emphasize polyphenols. What's that? Plants. Omega-3 fatty acids, 3 types. Fish oil, krill oil, and algae oil. Fish oil usually contaminated with mercury, usually goes rancid pretty quickly, and it's not in the phospholipid form. Krill oil, much better choice. Algae oil, a little more expensive. That's the purest form of omega-3s. That's the one I take every day. You should too. I take 1 gram a day. Fiber diversity. Just don't be taking, a store-bought fiber. You want to shake it up with different types of fiber because different types of fiber feed different types of bacteria. They're called prebiotics. Prebiotics feed the bacteria, fiber. Probiotics are the good bacteria. And postbiotics are what the bacteria spit out like B vitamins so that we can utilize it. So pre, pro, and post. And really plant-forward nutrition. I mean, I haven't had an animal product in 40 years. And at 65 years old, I'm running circles around the 20-year-olds. So the plant diet really works. I'm not happy with these high-protein diets. We can debate that. This is not the forum to debate it. But people that do a lot of high-protein diets over time, we're seeing a lot of negative impact, including inflammation on the brain. Short term, oh yeah, I feel great. I'm losing weight. I feel great. Long term, I'm not happy with it. All right, next slide. Okay, so here's a supplement protocol. I put a table in here if you want to. The omega-3s, membrane repair and anti-inflammatory. I do about 1,000 grams a day, 1 gram or 1,000 milligrams a day for concussion recovery. Magnesium glycinate, magnesium threonate works very well. I would say threonate from the neck up. Magnesium glycinate is kind of a general one. It's calming. It helps with headaches and anxiety. Curcumin, we talked about that. Turmeric, the active ingredient is curcumin. I like to take the whole turmeric because I find that it works synergistically with all the other ingredients. Curcumin is when you isolate it out, and we have the pathways there, helps with inflammation. Probiotics, you want to do multiple different strains because there's so many different bacteria in your colon. Akkermansia, for example, can help produce the short-chain fatty acids, and the short-chain fatty acids can activate the L cells, and that can help with your hunger. So Akkermansia supplements we're finding now really helps with weight loss. I recommend an Akkermansia supplement for patients so that we can start producing the natural GLP-1s. But in this case, we just have to rebuild the bacteria for dysbiosis. And if you're going to take vitamin D3, not D2, D3, I'm begging you, make sure it has vitamin K2 with it. Because one of the many things vitamin D does, it takes calcium from your food and brings it into your blood. K2 takes it from your blood and brings it into your bones. If you take D3 by itself, you have a very high risk of increasing of hardening the arteries, calcium buildup in the arteries. And when we have a traumatic brain injury, we want less calcium in our arteries. Not everybody wants less calcium, not more, to get better circulation into the brain to help bring down the inflammatory reaction. So I take 10,000 international units of D3 every day. They say you can do 600 a day. That's really just to not get a disease. I want to do a medicinal dose or a therapeutic dose. I do 10,000 IUs a day. You'd have to do up to 200,000 IUs for multiple weeks to see a toxic level. So 10,000 IUs of D3K2, I do it every day. I do a liquid one. I do it every day. You should too. Okay. All right, next slide. Okay, gut repair protocol. L-glutamine, okay, this helps tighten up the junctions. Zinc carnosine, mucosal repair. Aloe vera for soothing. I do a slippery elm tea. Slippery elm usually comes in a powder. You use about a half a teaspoon to a big cup of water. I'll add some sweetener to it, like monk fruit. And I'll drink that a lot if I'm doing a long lecture, if I'm teaching for a whole day, if I'm doing a long radio show, if I'm going to do a TV show. It has a viscosity to it and actually soothes the whole digestive tract, the gut, the throat. So I like that as well. Aloe vera works well. Digestive enzymes. I take a digestive enzyme every meal, and you should too. And the reason is when you were young, you produced a lot of digestive enzymes. And they broke down proteins, and they broke down fats and carbohydrates. I'll give you a whole lecture on digestion if you want to someday. And as I got older, I realized that I would eat food and I'd get a little bloated. I'd get a little gassy. Didn't work very well. Digestive enzymes are a game changer. So if you want to ask me later, I'll tell you which ones I take. But digestive enzymes, phenomenal. Now, if I eat a raw meal, let's assume I have a big salad. I don't take a digestive enzyme. But if I'm going to eat a cooked meal, I take one. If I'm going to eat a big cooked meal, let's say I'm going out to an Indian buffet or something like that, a lot of cooked foods, I'll take 2 digestive enzymes, protease, amylase, and lipase, and different types of it as well. But when you start breaking down your proteins into amino acids to produce the neurotransmitters, that helps the brain work better. So that's why I strongly push the digestive enzymes. And fiber, make sure you have different types. We talked about that because different types are different types of prebiotics. All right, next slide, Jan. I see we're cutting close on time here. All right, hormonal supports to consider. Red flags after a TBI. Persistent fatigue, weight gain, sleep disturbances, libido changes. We got issues. Now, I'm going to do a seminar coming up, and I'm going to call it, I'm joking when I say this, Functional Medicine for Idiots. Because it's so complicated, I want to make it so easy so that all of you, all of us, can start doing what they call functional medicine. As chiropractors, we can't call it medicine, but functional healthcare. Basically what I'm teaching you today. So you can do a cortisol test. I'm trying to develop a software actually so that people can just plug and play. These are the symptoms. What blood work should I order? What urine test should I order? So these are some of the tests. Consider evaluation of the cortisol levels, the free T3 and T4. I won't give you a whole lecture on thyroid today. Testosterone, free as well as non-free or bound testosterone, and your vitamin D levels. If you do a vitamin D test, and you should, they usually say, whoever they are, people smarter than us, can say like 40 nanograms per milliliter is good. I don't want that. I want up to 80, maybe a little higher, of nanograms per milliliter when it comes to vitamin D. That's the therapeutic level. And that's why I take vitamin D every day. I say vitamin D is the cheapest insurance policy you'll ever have. Vitamin D is so cheap as long as it's K2 with it, it's great. There is something called the Dutch test that can be helpful, but Dutch tests are really hard to read. I'm pretty good at them, but I still look at them and go, wow, this is really confusing. So I'm working on a software that'll hopefully analyze that for you, put it in English. All right, Jen, next slide. Vagus nerve rehabilitation. How do we get the vagus nerve to heal? Because it's been damaged. Maybe it's been stretched. It might be pinched. Upper cervical adjustments, very gentle. Diaphragmatic breathing. If you're a singer, you know all about that. Humming. Talked about this the other day on one of my radio shows, and man, I got bombarded with people. If you just go, that activates the vagus nerve. So if you can't get to sleep one night because you're in a sympathetic mode, whatever it is, you're stressed out, you're wired, you got a lot of things on your mind, just by humming, that can activate the vagus nerve, which is parasympathetic, which helps put us into the sleep mode. Gargling is the same thing, but it's hard to gargle for a long time. And with exercise, after a traumatic brain injury, you got to be careful. Overdoing it can kind of, what we say, blow it out. So our goal is to always restore parasympathetic dominance so that you sleep better, you go to the bathroom better, your love life comes back, you're happy again. So these are some things you can do. Now, there is a collar you can buy. It's a vagus nerve stimulator. I have one. I've used it. Maybe it works. I don't know. But when you fix the gut, you fix that afferent, remember those messages from the gut to the brain, and you start to fix that, and that allows you to go back into that parasympathetic mode. All right, next slide, Jen. All right, clinical implementation of the model step by step. So this is how you do it. You do a detailed trauma history, which everybody hope is doing. If you're not, we need to. A GI and sleep inventory. Do you have acid reflux, heartburn, burping, gas, bloating? Check their heart rate variabilities. Just feel their heart. Is it going up and down? Is it skipping? Nutritional intervention. Of course, I'm Mr. Nutrition. I love nutrition, but hopefully we'll have some easy stuff for you guys to use pretty soon. But at least ask them, hey, what do you eat? If you don't know what to eat, if you send me an email, I'll send you a lecture I did called So What Can I Eat? And you can give it to your patients. Happy to give it to you, to give to the patients, my gift to you. Supplement protocol. I think everyone should be on supplements. I don't think supplements are a luxury. I think they're a necessity. I can't imagine a day without taking my supplements. And I take, a methylated B complex. I take omega-3 fatty acids. I take D3 with K2. I take a men's hormone support. I take nitric oxide to open up my blood vessels. Nitric oxide is great. If somebody has low blood pressure, don't put them on a nitric oxide supplement. I don't like arginine as a nitric oxide supplement because arginine can activate all viruses, but especially herpes viruses, and cause outbreaks. Citrulline, much better choice. Okay, I do a citrulline supplement, and again, afterwards, if you ask me, I'll tell you which one I use. So supplement protocol, I think, is so important. Turmeric to bring down the inflammation. Gentle adjusting after a TBI, folks. Just be careful. And then if we do all this, I always say, let's do 30 days. Let's reevaluate and see how you're doing. Do we need to change your supplement protocol? Do we need to change our adjusting style? We want to go from there. So almost out of time, Jen. We open up to questions. Oh, your microphone's off. Turn your mic on, Jen. Okay.
Yes, I think we should, but do you have anything like just to roll out at the end here?
If you go to that last slide there, one more. Okay. There's our references. Yes. Yeah, these clinical takeaways. All right. Questions?
Okay, cool. Let's stop sharing so we can get you on the main screen. Dr. Richard Collin asks, could you touch back on the enzymes for cooked, not raw?
Sure. If I eat a raw meal, it has some enzymes in it. Now, it's not the same enzymes I produce, but it's going to help digest the food. So raw food is going to be a lot easier to digest than cooked food. Now, if somebody's gut is totally inflamed and you get them on a raw food diet, it can mechanically irritate the gut. We may have to go to a cooked food diet, but then a digestive enzyme with that. And make sure it has a lot of different types of protease, amylase, and lipase to break down the carbohydrates, fats, and proteins. And again, it's a game changer. It's phenomenal. I feel so much better when I take my digestive enzymes. I have them in my car, my house, and my office. So raw food, if they're okay with it, not so much, but the cooked food, always yes.
And I was curious, I think one of the biggest takeaways I had at the beginning and then as you were closing out the treatment protocol is the whole gentle adjustments. And how long do you think that they need to remain gentle? Because, is it just within the first 4 weeks or is it like several months? Like what have you found?
Depending how much trauma there is, if the ligaments are damaged, if the capsules have been damaged, 4 weeks minimum. I would go very gentle with the patient and then experiment. All right, Jen, I'm going to go a little hard. I'm going to go a little more aggressive today. How did that feel? Come back the next visit. How did you do on that one? I got a headache after that. Okay, it's not time yet. So minimum 4 weeks, and then you can start changing your style if you need to.
And then I know in your office, you're big on talking about cerebral fluid and how it's like decompression is that pump. So maybe talk about that because I mean, that might be intuitive to all chiropractors. For me, it was not. And
Yeah.
I think that most chiropractors do some form of decompression. Some have actual tables that are, more robust. But talk about how that can help in a TBI situation.
Sure. I study with Dr. Cox with the Cox technique. So the Cox technique, of course, if you know what that is, it stretches out the body. Well, I've got electric tables. Dr. Cox never liked them, but I have the electric mechanical traction tables in all my offices. Every room has them. And the reason is when I studied with Desjardins and SOT, I got to study with Desjardins. That's how old I am. We learned that the occiput and the sacrum do this type of motion. I can't see my sacrum, but it pumps up and down, and it's the sacro-occipital pump. And that pumps cerebrospinal fluid because we have the heart beating blood, pumping blood. We have the muscles contracting the lymph system, but we couldn't figure out what it was. So Dr. Still, way back in the early 1900s, he was the father of osteopathy, talked about the pumping mechanism of the occiput and the sacrum. And that's when Desjardins came up after studying Still's work and came up with sacro-occipital technique. And the big principle is if that occiput or sacrum are locked up, you're not able to pump cerebrospinal fluid. So by putting them on a flexion distraction table, we're mechanically pumping cerebrospinal fluid. So if you're treating TBI cases, you have to make sure the occiput and upper cervical area is moving properly and the sacrum. Because also with the sacrum, you're going to have proprioceptive fibers. So if somebody has an accident, I've been clumsy since the accident. Well, it could be damage to the cerebellum, could be the inner ear, but it could be a SI joint issue or a TMJ issue, which is also proprioception. So that's why what Jen was talking about is make sure you're unfixating the sacrum and the occiput. And that's why we put them on a flexion distraction table, every patient, every visit. So.
And you talked about like having dirty water. It's like in your brain, if you don't have that happening on a regular basis, that you accumulate debris inside the fluid. So this kind of helps flush some of the toxins and the dirty fluids through your body, right?
Yeah, that's very simply put, but very well put. Yeah, you got to pump that cerebrospinal fluid to get that old cerebrospinal fluid out. What does cerebrospinal fluid do? Brings nutrients to what? The brain. What are we talking about? Damaged brain. So you've got to get that cerebrospinal fluid flowing properly to get that nutrient flow in there. So another thing you have.
One of the things I love about chiropractors versus other forms of treatment and care, I think that there are so many elements that is not really enlightened in the personal injury case, where just by getting adjustments more often, most of these people that come through the doors don't see a chiropractor regularly. And so this is their door to be able to start healing from the inside out. They don't know everything that's happening, but those adjustments are such a key component of reducing inflammation and getting everything reset and synced. Even if you do just upper cervical and that's the way that you do it, the benefits of going through chiropractic care when you're in a personal injury situation is, to me, critical.
So often in a personal injury case, it's a numbers game. How much money can we make? How high can we get the bills? What's the limit? What's the insurance limit? We can only go to 25,000, and the attorney, of course, is going to want their 1/3 no matter what. And so the patient is oftentimes taken out of the equation, which is sad because the patient is the reason we're there. And I can't tell you how many times a week patients come to me and say, well, Dr. Joe, I went to one of those billboard advertising attorneys. Some of them are good, some aren't. And they said I had to go to this certain doctor. And I got 3 injections, and I got this, and the bill was, $100,000, and there was only $25,000 insurance limit, and so they settled for $15,000, and I'm still hurting. I didn't get better, and it's all a game. I remember talking to a big law firm one time, and I told them about what we do and my background and my team of doctors, and he said, "We don't work with chiropractors." I said, "Why is that?" They said, "No kidding. This is the truth. Your bills aren't high enough." That was it. That was the statement. Your bills aren't high enough. I said, well, we get people well faster. Yeah, but we want these $100,000, $200,000 bills. We don't want a $5,000, $10,000 bill. And I walked out of the office going, this is a game for a lot of people. It's just a money game. And I don't like that. I've been doing this too long that I want to have fun at this. And I love watching people get well. So just be careful.
Yeah, it comes full circle to you talking about treat the patient, not just the case. So right. I want to say thank you for your passion and not lowering the standard, lowering the bar, and raising it, because we all have the duty to help make these people's lives better in whatever hand we have in the process, and having more tools that will help them. Even just the idea of asking them about their diet, they might not even think about it. Those are the extra steps that can really help get better recovery. And that's something they can do from home that doesn't cost the case anything else except maybe some supplements that will help them long term have a better lifestyle. So appreciate you coming on today.
Follow for more tips and visit our website, neuro360care.com and allthingsneuro.com.
Top attorneys, leading clinicians, real strategy, real outcomes. October 7th to 9th. Register now. This is not just another conference. It's the room attorneys need to be in.